Hi, and welcome back to the Healthy Care YouTube channel. Today, we'll be discussing an important topic that affects many children and adults worldwide: learning disabilities. From reading and writing struggles to challenges with math and directions, learning disabilities can manifest in various ways. Understanding the early signs, how to diagnose, and what treatments are available can make all the difference for those affected. In this video, we'll explore the different types of learning disabilities, their symptoms, and how early intervention can help both children and parents manage them effectively. So, if you're a parent, teacher, or simply someone interested in learning more, stay tuned. 1. What are learning disabilities? To start, let's answer the big question: what exactly is a learning disability? A learning disability is not a reflection of intelligence, but rather an issue with how a person receives and processes information. This can affect their ability to read, write, do math, or even follow directions. According to studies, around 8% to 10% of children in the U.S. under the age of 18 have some form of learning disability. Learning disabilities can make everyday tasks much harder than they would be for others. For instance, studying for a test or staying focused in class might be particularly challenging. But here's the good news: with the right strategies and support, individuals can learn to cope with these challenges. 2. Common types of learning disabilities. Now, let's dive into the different types of learning disabilities. While learning disabilities vary from person to person, there are several key types that we can identify. Dyspraxia: this affects motor skills, which are essential for movement and coordination. Children with dyspraxia may struggle with things like tying their shoes, writing, or even holding a spoon. Other signs include speech difficulties and being sensitive to light or touch. Dyslexia: perhaps one of the most well-known learning disabilities, dyslexia affects how a person processes language. This can make reading and writing difficult, and it often causes issues with grammar and comprehension. Many children with dyslexia also have trouble expressing their thoughts clearly during conversations. Dysgraphia: this is a writing disorder. People with dysgraphia often have messy handwriting, trouble with spelling, and difficulty organizing their thoughts on paper. Dyscalculia: this disorder affects a person's ability to do math. Children with dyscalculia might struggle to recognize numbers, count, or memorize math facts like multiplication tables. Auditory processing disorder, APD. APD is when the brain has difficulty processing sounds, making it hard to understand spoken language. People with this disorder often have trouble distinguishing sounds from background noise and following verbal instructions. Visual processing disorder, VPD. This disorder affects how the brain processes visual information. Someone with VPD may find it difficult to read or tell the difference between similar objects. 3. Diagnosing learning disabilities. Diagnosing a learning disability can be tricky since there isn't a one-size-fits-all symptom checklist. Often, children try to hide their difficulties, which can make identifying the problem more challenging. However, some warning signs include lack of enthusiasm for reading or writing, difficulty following directions, trouble staying focused, slow pace when working on tasks. If you suspect your child may have a learning disability, it's important to speak with their pediatrician or teacher. You may need to consult with a clinical psychologist, school psychologist, or a specialist in developmental psychology, depending on the symptoms. These professionals can run a series of tests to determine if your child has a learning disorder. 4. Importance of early detection. Early detection is crucial when it comes to learning disabilities. The sooner a child is diagnosed, the faster they can receive the support they need to thrive. Pay close attention to developmental milestones like walking and talking. Delays in these areas could be an early sign of a learning disorder in toddlers and preschoolers. By catching these signs early, parents and educators can intervene before the challenges become overwhelming. 5. Treatment options and support. Once a learning disability is diagnosed, the next step is developing a treatment plan. In the U.S., children with learning disabilities are entitled to special education services under the Individuals with Disabilities Education Act, IDEA. This law ensures that children receive the education they need to succeed, free of charge, in public schools. The process begins with an individualized education plan, IEP, a personalized plan that outlines the specific services your child will receive. This could include speech therapy, occupational therapy, or one-on-one support in specific subjects. Outside of the public school system, there are also private schools, after-school programs, and tutoring services designed specifically for children with learning disabilities. 6. Parenting a child with a learning disability. As a parent, finding out that your child has a learning disability can be overwhelming. But remember, learning disabilities are not a roadblock to success. Here are some ways you can support your child, educate yourself, learn everything you can about your child's specific learning disability. This will help you make informed decisions when it comes to choosing treatments and therapies. Be an advocate, work closely with your child's school to develop an IEP and ensure they receive all the necessary support. Understand your rights under special education laws. Encourage healthy habits. A child who eats well, gets enough sleep, and exercises regularly is better equipped to handle the challenges they face. Support their emotional well-being. Learning disabilities can impact a child's self-esteem. Be on the lookout for signs of depression or anxiety and make sure to offer plenty of love and encouragement. In conclusion, learning disabilities are common but manageable with the right support. Early detection, proper diagnosis, and personalized treatment plans are key to helping children with learning disabilities overcome their challenges. Remember, learning disabilities don't define intelligence, and with the right tools, children can thrive both academically and socially. Thank you for watching this video on detecting learning disabilities. We hope you found it informative. If you have any questions or want to share your thoughts, feel free to leave a comment below. Don't forget to like this video and subscribe to the Healthy Care YouTube channel for more helpful tips and health information.